Good evening. My name is Jason. I'm a paramedic with CareFlight. Today my how-to speech will be about CPR, the steps to take doing proper CPR. There's three basic steps. One's going to be airway, two is going to be breathing, three is circulation. Without these three, you will not be able to perform accurate CPR. Step one is airway. To perform this, the patient needs to be lying down on the ground and open up the head with the head tilt chin lift to open up the airway to make sure it's patent. Then you visualize inside the mouth to make sure the airway is not obstructed with any kind of food or any kind of foreign object. And if there is anything in there that you can see, you need to do a finger sweep motion to remove it. Number two is breathing. You have to do this with the look, listen, feel. With the head airway still open, you need to perform a look, listen, feel technique. What you do is put your ear to the patient's mouth. That way you can hear and feel at the same time, and you can look straight down the chest to watch for chest rise and fall. While you're doing this, you want to make sure the patient's breathing, and if the patient's not breathing, you want to give 2 rescue breaths. With 2 rescue breaths, you have to have a mask. With the mask, you want to perform a seal around the mouth and the nose to make sure no air leaks out. Then you'll breathe through a valve on top of the mask to give the breaths. You give 2 full breaths. You allow for chest rise and fall in between each breath. Once you have performed this, you will move to circulation. To check for circulation, you need to find the carotid pulse, which is right here. So you take your fingers to the earlobe and just kind of slide it down the jawline until you feel a pulse. If you don't feel a pulse, that means the patient is pulseless. So then you'll move to chest compressions. To perform chest compressions, you need to be in the middle of the chest, in between the 2 nipples, right in the middle nipple line, what we call mid-nipple line, which is right in the center of the chest. To perform this, you want to put your hands together and press hard. You want to press hard and fast at 100 compressions a minute. The little trick we was taught was the song Staying Alive. If you kind of just sing that in your head, Staying Alive, you'll be able to keep up with the correct beats. So you want to press hard and fast. So you want to get down in the middle of the chest and just kind of go up and down real hard. Keep your arms straight and press hard and fast, but you want to allow the chest to recoil in between each compressions. What this does is allow blood to flow and allows the heart to beat. You're mechanically beating the heart. So you'll repeat this. You'll do in between 30 compressions. Once you do 30 compressions, you get 2 breaths again. So with those 2 steps, or those 3 steps, you can perform CPR. So remember, airway, breathing, circulation. We call ABC. Airway, you want to make sure it's open and patent. Breathing, if they're not breathing, you want to give them breaths. If there's no pulse, you want to provide chest compressions once you're making the heartbeat for themselves. So with these 3 steps, if you do it correctly, you are able to save somebody's life and do it correctly. Thank you and have a good day.